Hello, everyone. Thank you guys so much for coming out today. Um, like Shali mentioned, this was a part of a year-long project with our committee, the Gut-Brain Axis. Shout out to Yi, who isn't here today, but today we'll be talking about the gut-brain axis and how it specifically relates to Alzheimer's disease. First, we'll be starting out with some background, then into our rationale and hypothesis of why we decided to pursue this topic, our materials and methods for our prospective research topic, and our discussion as well.
Okay, to start off with a little bit of background, like you mentioned, we'll be talking about neurological diseases and the gut-brain axis, more specifically about Alzheimer's disease and the gut microbiome. One of the key components of Alzheimer's disease development is the buildup of tau and amyloid proteins, which we'll be discussing later in various studies that we'll be writing out.
So food disparities often disproportionately affect underserved communities. They often lack fresh and nutritious food, but their diets usually consist of highly processed foods. These foods can often cause stomach lining issues and inflammation. This led us to our research question of whether or not the link between Alzheimer's and the gut microbiome could explain the cognitive decline that arises.
Yeah, so when we were first initially looking through the literature, trying to identify a knowledge gap that we could maybe pursue and tackle, we noticed there were two main issues. The first of which is that previous studies didn't really capture the true essence and nuances of the Alzheimer's pathology because they would sort their patients into the negative control, the mild cognitive impairment groups, and just straight up Alzheimer's, which doesn't really capture the nuances that we wanted to investigate in terms of the gut microbiota. This is true because we know that the Alzheimer's disease exists on a spectrum with cofactors relating to age, race, and even with recent studies talking about specific parts of the brain and how they relate to the gut microbiota. Our second issue with current studies is the lack of case studies and longitudinal studies following maybe a few patients for a longer period of time, and maybe extracting conclusions from longitudinal studies would be more beneficial than just correlations. Our future research directives are to examine Alzheimer's disease progression slowly and with more nuance than maybe previously captured. This is just one study kind of highlighting that three groups, such as the negative control, the mild cognitive impairment, and Alzheimer's disease, as it relates to the beta diversity of gut microbiota. And this figure just shows different analyses and how the trends relate to the different groups, but it doesn't really show the true spectrum of Alzheimer's pathology.
So one of the papers we looked at probiotic treatments and how it showed a decrease in cognitive impairment in mice. So they started with two different types of mice, C57 Black 6 and germ-free Swiss Webster. Both mice were then infected with Citrobacter rodentium, and some of the mice were given probiotic treatments and some were left untreated. Following treatments, they were then given either a stress-inducing environment or a no stress-inducing environment. And after that, they were then given the behavioral test, either a novel object test that tested memory or a T-maze test that was coupled with a dark/light box test that tested both memory and anxiety. So C57 Black 6 didn't show any significance in either increase or decrease in anxiety or memory, but germ-free Swiss Webster did show a significant enough decrease in memory. The graphs on the right, the top two represent anxiety for germ-free Swiss Webster. They both didn't show any, both the treated and untreated. The white ones represent the treated mice, the black ones represent untreated. In anxiety, they didn't show much difference, but in memory, there was a significant reduction in exploration for both tests, which led to the correlation that probiotic treatments did prevent some impairment of cognitive decline.
So the second study that we'll be looking at was conducted in 2019 and focuses more on the role of the gut microbiome and more specifically what an oral fecal transfer can do between wild-type mice and EDLP mice. So if you look at the graphs presented on the screen, the top two performed two dissimilarity tests, both of which produce significantly different results between the wild-type gut microbiome and the EDLP gut microbiome. The bottom four graphs with parts C, E, and F, they also showed a significant difference. Part C represents intestinal permeability. Part E is intestinal inflammation, and graph F is systemic inflammation. So all of these factors were significantly different between the wild type and ADLP mice before the oral fecal transfer occurred. Then at the 8-month stage, over a 4-week course, the oral fecal transfer took place. After this occurred, they found that the amyloid and tau protein buildup that was once present in the ADLP mice significantly decreased. In addition, the factors that I mentioned before, such as intestinal permeability, inflammation, both intestinal and systemic, also decreased with the ADLP mice post-fecal, oral fecal transfer. So this signifies the importance of a very different gut microbiome present between wild-type mice and ADLP or Alzheimer's disease presenting mice, and also the benefits that an oral fecal transfer can have in reducing Alzheimer's disease presence and symptoms.
And so about correlation, if the studies tend to show a strong correlation between gut-brain axis and Alzheimer's pathology, that would kind of reinforce the current studies that we have. Whereas if there's a weak to no correlation, it would have us reevaluate our studies that we do have and kind of reevaluate the way we think about the way the gut-brain axis relates to Alzheimer's pathology. In a more future directions, we could do more longitudinal studies where we take individuals and we change the gut-brain axis and we measure them over time. We could also do a more multivariate approach where we change multiple variables in the gut-brain axis and see what most directly affects Alzheimer's pathology. In terms of diet, some steps that people could take to improve their gut-brain axis is to increase their probiotic intake, to place a greater emphasis on a Mediterranean diet, and to increase the amount of fish and vegetables that they are consuming. In a more broad and social aspect, more social movements should be created so that they can promote a more equitable and sustainable diet among all the members of our society. And these are just our citations. Thank you so much for listening.
All right. Any questions for this wonderful group? Hi guys, great presentation. So I'm wondering what your thoughts are on sort of the current, the evolution of what we think of when it comes to A-beta and whether it's toxic or it's actually a preventative measure for, preventing infection. I think on your first study, you had mice that were infected with something. Mm-hmm. Was it like a virus of some kind or?
The infection that they used, it's a common bacteria that it's used in mice to simulate what would happen in a human if they were infected with kind of like a stomach bug. Mm. The reason they used that that infection specifically was because it simulated what would happen in a human if they were infected with a stomach bug or something like that. They had the flu or something, and it would show like it isolated what would happen between the brain and what would happen in the stomach, specifically in the mice. Obviously, it's going to be different in humans because there's much more factors going around because in stress induction or environmental factors, but they used that bacteria specifically because it was most closely simulating what would happen in a human environment for mice.
Right. Yeah. And my next, I guess, mini question is like, how can you, incorporate that, what we know about the infection? Sort of, there's an infection theory of Alzheimer's where it is an infection that can cause an increase in like A-beta because A-beta is trying to protect the brain from this, and the lymphatics play a role in how to clear that system. So on top of diet, what are some things that you guys have seen in the research that could help, prevent neurodegenerative disease like Alzheimer's as a cause of infectious things like bacteria and viruses?
Honestly, we looked mostly at preventative treatment, so we didn't look a lot into specifically infectious diseases and like prevention for that. So we're not entirely sure 100% on that. That's a great question. I kind of want to go back and look into that kind of stuff and see the link between it. So if I do find an answer when I go back to my table, I will definitely come back to you about it.
Great. Yeah, and look at herpes too. That's what's studied in Alzheimer's.
Herpes, Alzheimer's link? Oral herpes. Okay.
Going into the brain, yeah.
Okay, that's interesting. Thank you.
Mm-hmm.
Would you be able to introduce yourself?
Oh,
thank you.
Wait, introduce myself?
Yes.
Just to everyone. Hi, everyone. I'm Dr. Claudia. I'm on the board of I&I. I want to say maybe for the last 10 years I've been on board. I've been a speaker here. I was a speaker at UCLA. I am a neuroscientist and mind-body expert. My thesis work was on neurodegenerative diseases like Alzheimer's, and I now work in the skincare and beauty world.
So much. Yes, for sure. Would you like to introduce yourself as well? Thank you so much.
We're going backwards now. I'm Bill Ryder. I am not a neuroscientist. I work in both corporate and individual work from an executive standpoint. My new book just came out. And my contribution I'm on the advisory board as well. My contribution from time to time is being able to relate science, neuroscience, to normal human behavior in the workplace and personal environments. So I always look for the practical connection in terms of how does this affect everyday life. Thank you.
So,
All right, anyone else have any questions for our gut-brain axis group? Okay, sounds good.